Hello, everyone. My name is Larissa Finley, and I'm the Marketing Manager at Computeries, and I'm also the VP of Education of the Greater St. Louis MGMA. And welcome to our May webinar. So before we start the meeting, there's some upcoming dates to keep in mind. Wednesday, June 9th from 12 to 1 p.m., join us for the annual Government Update webinar. It's featuring a panel of 5 Missouri legislators, all serving on the Health and Mental Health Policy Committee. And at the end of the presentation, everyone should know and understand the major issues of the 2021 legislative session, especially health-related bills and how this might affect their medical practices. Also, save the date for our in-person event of our annual fall conference on Wednesday, October 13th. We are very excited to see each other back in person. It's been quite a while. And mark your calendars and keep an eye out for more information soon. So now I'd like to introduce today's speaker, Stacey Christensen. Stacey is the Director of Healthcare Brand Strategy and Professional Office Services, and she has 25 years of experience in communications, including public relations, media relations, community relations, and marketing. Stacey helps customers create strategic messaging and marketing plans to solve their toughest communication challenges, and her expertise includes communication strategy and marketing and communication plans. Currently, she works in healthcare communications at Professional Office Services, where she helps create communication tools and strategies to help practices engage more with their patients. Stacey earned a master's degree in communications from the University of Northern Iowa. So thank you very much for being here with us today. And I will hand it over to you. I am also going to be moderating the chat for questions. Stacey is very open to questions at any point during the presentation. So please definitely engage with anything that you might have a question about. And I'll let you take it from there, Stacey. Thanks.
Great. Thank you, everybody. I'm happy to be here with you today. The sun is shining, which is really nice. And I'm going to be off the next couple of days on vacation. So it's a great Wednesday, right? So thanks so much for joining today. I'm going to speak with you about marketing and communications to improve your patient engagement. As Larissa and Kara indicated, please, use the chat feature throughout, ask questions. I'd be happy to engage throughout or following as well. So my goal today is to make sure that I give you just some practical, intentional best practices and how you can make the most of your communications with your patients so that you can attract new patients, provide a great patient experience, and make sure that you're retaining those patients as well. So as Larissa mentioned, I'm Stacey Christensen and happy to be here again with you all. I engage with many of our larger healthcare clients throughout the country on some of their strategy and their marketing efforts. And so definitely happy to share some of the input and examples that we've helped practices implement throughout the country. So I don't think it's a secret that the world that we live in today is full of noise. Take COVID aside, that certainly added a whole other layer of communications and distraction for sure. But as marketers, we face a lot of challenges today in how to best communicate with our audience, and in this case, our patients, right? So is it direct mail? Is it text messages? Is it phone? Is it digital advertising? Is it social media? And the answer is all of the above. I think that today it's important that we have strategies that aren't a one-size-fits-all, that we have to make sure that we are communicating with patients in the way they want to be communicated to, but also trying different things for marketing. So if you're doing a direct mailing, making sure that you're marrying it with a digital strategy that mirrors that content and so forth. And so research shows that it takes, at least 7 different touches to get the end user to take the behavior that you want. And so I think that's important to know that sometimes we feel kind of defeated when we try things as marketers to say, well, we struck out, but we need to take that concept and try it 3 or 4 different ways and be persistent and consistent. So what I'm going to focus on today is the patient life cycle. And that is something that we have termed here. We have 5 phases that we like to educate practices that we work with on as far as opportunities for intentional marketing and patient communication touches. So from the time you welcome a new patient to their treatment, to when they're leaving and paying their bill, what does that engagement look like throughout the year, and how can you best market your practice? And so what I'll give you is just some real life examples of some of the ways that you can do that in more of the traditional marketing touches. So let's start with the new patient. You know, a lot of patients coming to us have never had any sort of encounter with your practice before, whether you're a specialty practice and they came through on a referral. A lot of times their very first engagement is going to be when they walk through the practice to register. And we did a focus group recently, and 77% of the practice administrators and marketers in our focus group said that they believe that their new patient communications could definitely use improvement. So 77%. And this is important because, as I mentioned, a lot of times that first engagement is through patient registration, whether it's online or whether you are sending a packet or they're completing the packet inside of your office. You know, I think it's sort of important to note that some recent research showed that only 2.4% of a new healthcare patient is going to register online. And part of that is because healthcare patients are a little bit leery to share so much information online. And so I think you are definitely going to see the need to still have some more of those traditional welcome packets in your practice. So what I love about this particular client that we work with, C-Care, out in California, is that they wanted to condense all of the different forms that they had in their oncology practice. And so we were able to sort of take, you know, 15 different key pieces of information they collected and condense it, make it more easily able to be completed, appeasing to the eye, certainly branded, but they took the next step in making it more of a welcome packet. So knowing that many of these patients, because they are a specialty line, were coming into them, they wanted them to know who they were. They wanted them to know their different locations, a little bit about their practice. And so they put this all in a really nice envelope that was sort of very unique. And as marketers, we're always looking for something unique. And what I liked about it is that the functionality of the envelope was really designed quite engaging, so that they'd have to open it and really engage with that piece. And what was brilliant was that they made it so that they could interchange out provider bio cards too, so that as you grabbed one, welcome to patient, if they were seeing a certain provider, they could put that provider rack card in as well. You know, again, this would be a community health center. We do work with a lot of federally qualified health centers. And one of the things that we're noticing a trend from our customers throughout the country is that they want to do more of practice overview books. And so we helped this particular practice that needed them bilingual as well. And this is an opportunity for them to really tell their story, right? Again, all of that information so that the relationship isn't just transactional, right? You're not just collecting paperwork, you're giving them something in return that says, you know, these are our values. This is why you should feel good that you're here. And so these have been some very popular pieces coming in. Some practices choose to do a much more elaborate idea as well. And again, I'm just giving you ideas. So as you're registering new patients to your practice, beyond just registration forms, especially say you're an ambulatory surgery center or a practice that's going to be doing some pre-op and post-op. Some practices will choose to include a presentation folder, you know, put those booklets in there, let them keep those registration forms or certain policy forms that they signed so that everything is neat and completed and in one location. And so lots of different options for you to improve the patient engagement for sure. So now that you've welcomed patients, hopefully they've got all the paperwork done, they've had a good experience, it's time for them to go and see the provider. And that diagnostic and treatment phase is critical. And especially this last year with COVID, what we learned was patients weren't able to bring in visitors a lot of time or a companion into their appointments. So imagine the information that's getting conveyed and family members want to know about it, but the patient might be confused or it was too much information to retain. They struggle to get that information back. And so oftentimes what's happened, and I know I've talked about this in past presentations, is that, we have this thing called the internet, right? You can Google search anything, and it's an amazing tool. I do it all the time, but it's also sort of a double-edged sword, right? Because it's full of bad information. And so what I always tell practices is you want your providers to own their story, right? Not every provider, has the same philosophies on treatments, on medications, on things like that. And so don't let the internet be telling your story in the way that you want patients to handle their treatments. And we do know that, more than 80% of patients do Google searches to find a practice, but also to research their condition as well. And so knowing that, you want to say to yourself, what are they getting from our practice? What are we giving them so that when they walk away, they've got something they can bring back to their family members that tells them how they're supposed to be handling their treatment as well. So I think it's really, really important that we remember that. And again, in a focus group that we recently held with some customers around the country in healthcare, 27% of them said that they really lacked good treatment and educational materials. And so this is just one example of a way that you can, in surgical, dermatology, ophthalmology, whatever you are doing for treatments, to make sure that you're giving them something that says what they can expect prior, what they can expect during the times that they're having the treatment, and what that post-care looks like. Something that they can put in that packet or bring back to their family members that speaks to your practice and how you're handling that communication. Certainly, slowly, practices might be considering putting some literature back into those exam rooms or lobby rooms, waiting rooms. Certainly, with telehealth and with COVID, we were trying to eliminate some of those handouts, but I do see them, coming back. And so you have an opportunity while they're waiting to make sure that you're educating them as well. What I want to say is that it's important, especially as a marketer, and an administrator or office manager, to make sure that whatever you're doing, your brand is on those pieces, right? Whatever you're handing out to that patient that's going to go into the public, you want to make sure that you've got your logo on there as well, okay? So take a look around your walls as well. I think this is definitely communications, right? All of the signage that we've got taped up and posted up, and certainly in this last year, think about all of the precautionary messages that we've had to share to make sure that we were keeping our patients safe. Make sure they're professional looking. You can do that in a way that isn't taking a laser copy with masking tape, right? You can do some signage that's more branded as well. And so this QR code is something that I want to speak to, because one of the things that I'm finding in healthcare and beyond healthcare is the QR code is trending back. I never thought it would. If you asked me 2 or 3 years ago, I thought it was the silliest thing I'd ever seen. I just didn't think that it was going to stick around. And some would argue it was dead in the water when it started. But I can tell you in this last year, if COVID did us any favors, it's the fact that a lot of individuals have gotten used to having to scan for information. And because mobile technology no longer requires that you have to have a special QR scanning application, you can just hover over those QR codes and get all your information. As a marketer, what I love about it is it forces a secondary intentional piece of engagement with your piece of literature or something. It's making them stop to read it. They're engaging with it. And so that's just a little tip for you as well. So now that we've gone through those first 2 phases of the patient life cycle, we're at the financial phase. And this might be arguably one of the most important phases of the life cycle, because even though we're all in the business of healthcare today to, really make sure that we're improving health outcomes, and because we care about patients, we can't do that if we're not paying our bills. And in order to do that, we need to make sure that we're being very clear and upfront when we're registering patients to our practice, that they understand what it is that they owe and that they understand what your policies are. And so again, in a recent focus group that we did, overwhelmingly, almost 95% said that they could definitely use some tips in improving their financial communication. And I think the reason being is twofold. As marketers and administrators, we often aren't in the billing department, right? And so you've got your billing team and your accounts payable team that's sending out statements, and they're sending out educational information to patients, or they're putting together those different forms, and they don't necessarily think like marketers, nor should they, right? And so when you look at something, they're not looking at it necessarily from a visual aesthetic, or is our brand on here, or is it easy to understand? Do I know where to look to pay my bill? And so this is an opportunity for administrators and marketers to engage with the accounting office and the billing office, and to say, let's take a look at the statements that we send out. Let's make sure that we're offering the best information, and that we're clear in what our policies are and what our past due notices are and our final notices. And also, there is an awesome opportunity. You're already sending out a bill, right? So something's already going out from your practice, to put a statement insert in there on any sort of marketing message you want. It doesn't have to be just about that bill. Certainly many practices will choose to talk about, the fact that you can now pay your bill online, or that they've got payment plans. But you can also share immunization clinics, that you're welcoming a new provider, that you're moving to a new office location. This is a really easy and economical way to get a piece of information, and since you're already sending something out already. So I would definitely encourage you, if you don't already, to work closely with your billing team so that you can work on what some of that collateral is. So we're at the fourth phase of our patient life cycle, and that's the patient engagement phase. And this is when the patients aren't necessarily with you for, treatment, but what are you doing to make sure that you're keeping your practice top of mind, so that they don't wander off to another practice down the street, right? Because we know that the healthcare landscape is more competitive than ever. And especially, those independent practices that are still out there are finding themselves having to market more than ever. But this patient engagement phase within the healthcare lens really allows us to focus on wellness, right? What are we doing to engage patients so that they are keeping up with their screenings, their immunizations, so that they're being the healthiest they can be, and we're preventing some of those chronic conditions. And a big opportunity is in the good old-fashioned mail service. Now, some people will argue, and everyone's got opinions on this, that mailings or direct mail is not the way to go because they feel like the market is saturated. But so is the digital market. And so what you're finding is, just as I talked about those QR codes trending back, what you're finding is that mailings and direct mail is starting to perform better because of the digital saturation we've experienced in the last couple of years. So we do know from the U.S. Postal Service and all of the research they've done, we know that 98% of people go to their mailbox at least daily. You have to, right? Because you've got bills in there and things like that. So in healthcare, we also know that you're obligated to send to patients important letters when a provider's leaving, for example, right? They're leaving the practice, you need to let the patient know. So I would like you to know that I'm going to put a small plug in that POS does have a full service mail department. And we know that the Postal Service is very, very confusing these days. And so we can help you navigate some of those waters, make sure that you're getting your pieces out the way they need to be in the most economical way. So whether it's provider letters or maybe it's direct mail campaigns, you want to talk about that new office location. You want to talk about a new provider coming. There is a lot of power and a direct mail piece. Some research shows that an actual mailing has a lifespan of, at least 17 days versus an email that you dump in a day. So that you tend to keep it on that kitchen counter. You tend to tuck it away a little bit longer than you would retain that email. What I'm finding is a lot of practices with this focus on population health and, having to report quality metrics that practices are, alerting patients when it's time for the colonoscopy or the mammograms or the cancer checks. There's a great way to do it when it's your birthday. So think about, looking through your EHR and combing that information for age-based screenings, right? So you're able to sort of generically say, that, women between the ages of 18 to 24 need these vaccinations and screenings, 24 to 48, so on and so forth. And you're also giving a really nice touch as well. And you're sort of kind of conveying that emotional story that your life's going to be better if you keep up with these screenings. So a little tip for you. Excuse me. This is a practice that we work with. We do a lot of oncology. I have a little tickle, excuse me. And it was important for them to sort of showcase their providers, but also make a message that, hey, during this last year, we know that COVID has caused a lot of people not to come in for their vaccinations and their screenings. And as marketers and healthcare professionals, we've seen the research. We know what these next couple of years are going to look like. What is this last year of missed appointments going to mean in people's future diagnoses and health? And so there's a big effort right now to get those patients back in for those missed appointments and those screenings, and definitely direct mail is a good way to do that. So let's talk about that final phase of the life cycle, and that happens to be practice marketing. So you might say, well, practice marketing doesn't really have something to do with the patient life cycle. Well, it does, in the sense that, remember how we talked about the financial piece? You need to constantly be out there and making sure that you're staying relevant, that you're keeping up with your competitors, that you've got just a little bit of an edge, because there are a lot of options for patients to choose now. And so I would encourage you definitely to start with your referring provider materials. So most practices have someone who wears the hat of the provider relations liaison, right? And again, because of this last year, it's been very difficult to go out to those practices that you rely on and those relationships you have with providers to get them to refer to you, because you can't get in, right? So the days of hosting, a nice luncheon or fancy receptions or workshops or things like that have been very hard. And so you need to say to yourself, what am I getting in the hands of those providers that are referring patients to me? And so whether it's, a thank you card and saying, I want to let you know that, we've got 3 or 4 new providers or new services. It's something that you can drop off. It's something that you can mail, but it's very, very important that you do that. Again, the trend I'm seeing, just because we get, seated on all of the samples that we do for our clients, is that they're choosing to put together what I call kind of a toolkit. And so it's a referral packet. So, the good old days of just giving a referral pack. And there's still a lot of value in that. I mean, please don't take me wrong. But a referral pad doesn't tell your story. So if you're trying to go after referring providers, a lot of practices are choosing to put in that brochure, a provider bio sheet, maybe something that whether it's a magnet or something that they can be leaving in that practice. A letter, really a heartfelt letter saying, we really do want you to know that when you give your patients to us, they're going to be well taken care of, and this is why. So referral packets are something I'm definitely seeing more of. So announcements. I mean, when you think about the amount of information that you have to send out to your patients, you've got new services, new pieces of equipment, providers coming and going, expansion, consolidation. How are you getting that information out? Certainly digital campaigns. I definitely encourage you to always do a digital campaign as well. So if you're doing something in print, take a look at what your digital strategy is. Do you have that same information at least on your banner on your website? on your social media. If you've got a digital Google ad spend right now and you've got limited dollars you're using for keywords or advertisements, make sure that whatever you're focusing on for that campaign, again, that you're looking at several different ways of communicating to those patients. I want to talk a little bit about online print management. This came up in a couple of focus groups that we've done the last several months. And one of the things that we're finding is that especially large practices, as they continue to expand, they continue to hire more providers and have multiple locations, they really struggle with how to manage brand consistency. Almost 50% of practices said that they really, when they partner with somebody, they're looking for someone that can help them manage that consistency, but they're also looking for somebody that can help them save time. Because we know that we all wear several different roles. I know here at POS, I mean, I'm not just a brand strategist. I have 2 or 3 other roles that I fill. And so time is very precious. And so anything you can do to streamline. So if you are looking to, work with vendors and partners to help you with marketing, ask about what online print management services are, right? You're going to want to work with somebody that's got the ability to make sure that brand consistency standards are locked in throughout, that you're able to give access to multiple users and locations, that you can integrate it with, whether it's POs that you use or cost centers, that you can easily place repeat orders online. We're not talking about design your own brochure or anything like that, but when you work with POS, you get an online catalog of all of the information that you've ever placed. And that technology piece is something that's going to be becoming more and more important in the industry today for marketers and third-party agencies. And so I just want to draw your attention to that. I sort of want to close and then open it up for questions with this closing slide. And you might be saying, okay, what am I looking at? I wanted to show you the power of just a consistent brand. So Utah Cancer Specialists came to us and said, I really need help sort of refreshing my brand. Want to make a little tweak or something like that. I think we could modernize. We need to facelift our materials a little bit. But what I love about them is that they had the forethought to say, I need to take a look at all of the different pieces of traditional collateral that we're giving to our patients, and I want it to look the same. I want people to know that it's from Utah Cancer Specialists, and there's a lot of power in that. So as you walk away from today's presentation, think about your practice, think about the story you want to tell, take a look at your materials and say, am I really putting my best foot forward in engaging our patients and telling our story and making sure that our marketing is the best it can be in the community. So I like to keep these relatively short because I think our time span, attention spans start to wander after a good half hour, and I like to allow time for an engagement as well. So I thank you very much for allowing me the opportunity to visit with you today. If you want to continue the conversation, I would be more than willing to connect you with our local rep or also have answer any of your questions. Again, just a little bit of information about professional office services. At the heart of what we do, we are a printing company. But we also have electronic products and services on the billing side and digital messaging. But we really, really, at the end of the day, want to help our practices take a look at the different communications that they're doing and make sure that they are engaging patients so that they are staying with your practice and that they're having the best health outcomes that they can. So with that, Larissa, I'm going to turn it over to you and let me know if there's any questions.
Excuse me. Okay, so let's, anyone who has any questions, you can put them in the chat. But Stacey, thanks so much for sharing that information. It was really great. It's, I think it's really interesting how direct mail is coming back these days. Digital everything, but people still like to have something in hand to look at. It's very, very good reminder. So I do have one question that was submitted previously. So is sending age-based screenings as a postcard and not in a self-enclosed envelope HIPAA compliant?
No, that's interesting because the very first practice, CHI, that did that with us, we have a HIPAA compliance officer with our organization because of the billing and statement processing side of our business. And we had her vet it because the client was very convinced that they still had to put that insert in an envelope. And they still chose to do that, but they didn't have to. We reviewed it, and there's nothing on there that was violating any sort of patient confidentiality. I mean, it's truly educational. It's saying that, during these ages, these are the screenings you have to have. It's not saying that you had a pre-existing condition. So there was no HIPAA concerns with those pieces at all.
That's good to know. That's something I don't think I realized. Let me see. And then can you tell me, what is some of the costs and return on investments for some of the direct mail campaigns that you've seen done?
Sure, that's always hard, right? So I also work with healthcare foundations on their nonprofit mailings and what they can expect for donor acquisition pieces as well. And so I've been studying this ROI quite closely. The industry averages, say, anywhere from 1 to 5%. And that may seem small to you, but if you're sending out, a 5,000 mailer, if you were to get 5% return, meaning somebody actually called in to make the appointment, that would be pretty good. So that's average industry standards. A tip on that is what we're finding is, and you can Google healthcare marketing trends in 2021 and find this information too, is that they're encouraging that you put a phone number, even though QR codes are very good, and driving people to a web form is not always your best ROI for engagement, but actually forcing them to call in and take action. And so the use of that telephone number is something that you want to consider as well.
Okay. And let's say there's a practice that hasn't really even begun to think about their branding. They have things that are here, like a smattering of different pieces. What would you recommend? Where would they start? Where's a good place to even start?
Yeah, that's a great question, right? Because we have limited resources. We don't have endless budgets, right? I mean, so you have to really start small, right? It's kind of that old saying, you just sort of take kind of one bite at a time. I would start with the new patient because since that's the very first look that they're going to have. I would take a look at what some of those core materials are that are patient facing when they walk into your office. So whether it's that welcome packet or the registration forms, take a look at that and see if you can make some improvements and then work your way through the life cycle from there. Now, if you're needing to really refresh your visual identity from a logo perspective, and you want to modernize that more, then you start strictly just with that before you even jump into the collateral would be my recommendation.
Okay. Very cool. We do have one question that popped up. For direct mail prospecting, do you recommend using market segmentation or block group methods in order to improve response rates? And does your company help with this?
Yeah, we do. So I always recommend market segmentation. I like the A/B testing too, if you have the ability to do that, to sort of test out a couple different segments. Within our mail services division, we also have list acquisition. So we actually have a project manager that just works with clients on getting their lists put together, whether that's through a purchase list, through an every door direct mailer. But one of the partners that we work with for our purchase lists, they've also got health ailment data lists. And so they've got like the most common health ailments. So like a lot of practices are coming to us saying, I want to get something out about LASIK surgery or cataract surgery. So what it is this particular third-party partner they're able to collect consumer buying behavior, right? So it's all self-reported data. So we're not, violating any sort of, HIPAA or PCI compliant information. It's basically saying, okay, we know that this individual buys, eye drops, or they buy gas tablets or whatever it might be. And so these ailment lists are becoming more and more tailored, and with homeowner surveys that are out there in the self-reported data, you can get pretty laser focused. Gone are the days of saying, I want to do a geographic targeting of just zip codes and incomes, but you can say, I want somebody that has a possible pre-existing condition in cancer or something like that. And we can get some ailment specific lists. And I think that is something to definitely look into.
It's amazing how much information we have these days, isn't it?
Yeah, it's almost kind of scary, right? I know, it's almost like Big Brother's out there, right? So it makes me kind of wonder too, when I'm shopping at like Target or something, and you're purchasing things and you're like, oh my gosh, somebody's gonna, get my buying behavior.
Yeah, that's definitely a little scary sometimes. So there is another question. Any tips or suggestions for dealing with the problems and delays the Postal Service is experiencing right now?
Oh man, I wish I had the answer. We used to pride ourselves. We had it down to a science. So we knew in all parts of the states, like when we could tell clients when to expect their mailing, right? So, we're shipping, whether we were shipping out of Iowa to Missouri, you're going to get it in 2 days, but what it might be, or a day, Florida, Utah. Well, this last year, I mean, it's just been awful. And so the Postal Service will not guarantee. They will no longer stand beside guarantees. Even if you do a FedEx or a 2-night delivery, they aren't going to be able to guarantee that anymore. And so what we're doing with customers, especially when they have an actual like drop date, like this has to be in the mail on this date, either for legal obligations or on our fundraising arm of things, we're actually adding a week or two to the timeline. So if I'm working with a client and I've got a timeline on a project, I'm coaching them to add a week or two on that, because I just don't, I've seen it. Sometimes the postal delivers in 2 days, other times a week later, we're still waiting. And it's because they won't do any sort of guarantee with the saturation right now. And so I encourage you to add at least seven business days to projects that you're working on.
That seems kind of ridiculous, but we have to do what we have to do sometimes,
Yep.
right?
Yep.
So can you, we do have another question also. What trends are you seeing in healthcare marketing today? I know you talked a little bit about that in your presentation, but a little bit more depth would definitely be helpful too.
Yeah, sure, you bet. So I'm finding that a lot of the independent practices that haven't joined big health systems, right? There's so many independents. I mean, smaller and smaller numbers are out there. But what we're finding is that they have come to the conclusion that they need to start marketing. And that is something that's been very foreign to them, right? So you've had an established practice for 30 years. I mean, you've just relied on the fact that you had the best doctor there. He'd been there for 30 years. But now with all of the consolidations and independence sort of, diminishing more and more, we've got people coming to us saying, we've never really had to market. We've never had to think about getting new patients. And so that's definitely something that I'm seeing. And I'm also seeing more of a reliance on referring providers. Like it wasn't until a couple of years ago that I started to really do marketing pieces for referring providers, right? You always just did patient acquisition pieces, but an actual targeted campaign to practices outside of their own practices, if you will, is definitely something that will continue to rise as we all look to acquire more patients.
So just a question for me, how would you get a list of referring providers that you would want to target? Is that something that you guys could help with, or a list acquisition, or is that something that is just known among providers who you want as a referring person?
Yeah, sure. A lot of those provider relations liaisons have their own network, right? They have a pretty established network of their core, 10 or so that are really good about referring. And so they just continue to make sure they get their message out. But we did actually just do quite a large outreach effort with a client on the West Coast that wanted to do, I think it was like 1,000, he wanted to send 1,000 letters to primary practices. They were a dermatology practice and wanted to send this mailer out to primary providers. And we were able to purchase that list. We had filters and fields. They wanted a certain geographic standard, certain practice size, things like that. And so again, that is something that we would do through a purchase list acquisition.
Very cool. Thank you for all that wonderful detail. It's definitely a lot for a practice administrator to think of on top of everything else that they're doing. So any sort of help is definitely needed and appreciated, I think. So does anyone else have any questions, or Stacey, do you have anything that you think would be additionally helpful?
No, I mean, no, I've enjoyed the time. I think kudos to everybody that works in healthcare today, right? I mean, we, no matter what your role is, it's been a challenging year. My daughter is a student at the University of Iowa in the nursing program, and I get to kind of see a different side from her. She's talking about having to navigate the EHR systems and just everything that they were faced with this last year, with COVID and just all the extra restrictions. I mean, it's definitely a tribal effort to continue offering the best experience we can, but it's exciting to see that we're kind of coming out on the other end of it and being able to get back to some of those more core marketing efforts and not just have to talk about the COVID pandemic 24/7. And so, to all of you in healthcare on the call today, I mean, thank you, because I've seen firsthand the toll it took, and I feel like we're coming out on the other side.
That's definitely, I love that hopeful message. We're going to make it through. We're going to be back to meeting in person sometime soon as well for our organization.
Yep.
So I'm going to wrap it up for now. And if anyone has another question, you can put it in the chat, but I'm going to do the closing announcements. So thank you again, Stacey, officially, for spending time with us today and sharing this very helpful information. So you can keep an eye out for an email from us that includes today's presentation handouts and on-demand viewing information, the speaker's contacts, and a brief feedback survey. And we appreciate you taking the time to provide any input and use that information to improve the quality and responsiveness of our future educational events. And don't forget to join us for our next meeting on Wednesday, June 9th, a webinar learning more about the legislative update. You can register on mgmastl.org. And lastly, now is the great time to renew your MGA membership. If you haven't already, keep in mind that Greater St. Louis MGMA webinars are free to join for members only and also available for later on-demand viewing all year round. So you can renew or sign up online at mgmastl.org or contact Chapter Administrator Karen Nagel at administrator@mgmastl.org with any questions you have. And we appreciate all of our members, and we invite today's guests to join and be a part of our great network. So thank you very much, everyone, and have a great rest of your day.